This video will show you how to set up, use, and clean the ED Intubation Hood. This is a non-venting hood design. The most common vectors for contamination and infection with COVID-19 come from large droplets and fomites on surfaces. This hood is designed to significantly limit the spread of droplets and reduce contamination of personnel and equipment during an intubation. First, make sure you are intubating in a negative pressure room and all members of the team who are in the room have full respiratory precaution PPE, including N95 masks. The intubation tent does not remove the need for standard PPE by all personnel during the procedure. You should have 2 sets of gloves on, as this will be needed for appropriate cleaning of the frame after intubation. And also make sure that you have purple wipes in the room, as these will be required for cleaning of the frame after intubation. Place the frame in the position shown over the patient's head and secure the frame to the bed by rotating the bed hook as shown here. Place all of your airway equipment on the bed next to the patient's head and shoulders. This includes the bag valve mask, the ETT tube with a stylet, a 10 cc syringe, a supraglottic airway like an eye gel, an oral airway, Yankauer attached to suction, a bougie, and a video laryngoscope. The cables for the video laryngoscope and the suction will go underneath the frame, as well as the tubing for the bag valve mask. Please note that the tubing for the Yankauer suction should go underneath the frame for the tent, and likewise the wire for the video laryngoscope blade should go underneath the frame as well. Note that the tubing for the bag valve mask should go underneath the frame as well. Place a clean, unused plastic drape over the top of the frame. The plastic drape has brown lettering on one side. Make sure that the brown lettering faces towards the patient's chest and away from the operator, so as to avoid obscuring the operator's view of the patient through the frame. Creation of armholes in the intubation tent requires 2 large tegaderms. Apply 2 large tegaderms to the drape on the operator's side. These should be applied slightly above the patient's head level and separated roughly 12 to 18 inches apart. Using a number 11 blade, make a vertical 6-inch incision in the middle of the tegaderm on each side. Have RT insert the ventilator tubing from around the front edge of the intubation tent so that it's within easy reach for attachment once the patient is intubated. Confirm with RT that capnography is available and calibrated on the ventilator. Communicate with the team that you are ready for intubation, and then proceed with pushing the meds. And once that's done, then lower the patient to the supine position. Insert your hands and forearms through the tegaderm until you feel comfortable and have sufficient freedom and maneuverability under the tent. This will vary by operator. Perform video laryngoscopy. Inflate the cuff and attach directly to the ventilator if visualization and intubation was easy and there was visual confirmation of tube placement on the monitor. Remove hands from the hood and then clean the gloves with a purple wipe. In preparation for removing the plastic bag from the frame, lower the bed as much as possible. Grab the top of the plastic drape and pull upward until the drape has cleared the frame. This technique allows the patient-facing surface to stay inside the drape, i.e. it will fall together like an umbrella closing. Roll the drape up, touching only the outside, and then place in a biohazard bin. All single-use equipment that was used in the intubation should be considered to be contaminated at this point and should be placed in a biohazard bag and sealed. This includes the single-use CMAC blade. While the intubation frame is still on the bed, use purple wipes to wipe down the entire frame with the exception of the portion that's in contact with the bed, including all of the corners and the elbow and T-pieces. Once you've completed wiping this down, allow the frame to dry for 2 minutes. Once you've finished wiping down the frame, remove the now dirty gloves, the outer set that you had, and discard those contaminated gloves in a biohazard bag. Once you've allowed the frame to dry completely for 2 minutes, pick up the frame, touching only the parts that you previously had wiped down with a purple wipe, and without letting the frame touch the patient's bed again, use another purple wipe to clean off and wipe down the parts of the frame that had been in contact with the bed before. And again, without putting the frame down back on the bed, allow the frame to dry for another 2 minutes. Once the frame has been completely wiped down and dried, you can place the frame outside the patient's room. Using a purple wipe, clean off the gloves that you're wearing at this point. Once you've cleaned them off with a purple wipe, don a clean pair of gloves. And then use a purple wipe to clean off the screen of the video laryngoscope as well as the cable that was connected to the BL blade. Once you've cleaned off all of those surfaces, allow it to dry for 2 minutes, and then you can push it outside the room. After you've done that, you can remove the outer pair of gloves. And then you can doff your PPE using the standard monitored technique. This concludes the video demonstration for using the ED intubation hood.